Join us as we conclude our conversation on maternal mental health with Dr. Kimber Shelton. We discuss choosing culturally competent healthcare providers and self-advocacy tips that you can take with you. Is it more of a general kind of, you want to make these kinds of improvements, you want to prepare this way, and I can just help you generally like that?
Mm-hmm. Yeah, I think it depends on what your needs are and what your mental health concerns are. So that I know that I work with women and we're working on whatever their presenting issue or concern was, and then they become pregnant. So then we transition to also being able to include their pregnancy experience in their overall treatment, and that works fine. But if we have had specific birth-related issues, then we might want to find someone who specializes in those specific issues. So if we have fertility issues, we might want to find a therapist where that's their specialization is on the mental health components related or mental health issues related to infertility. If we've had experienced pregnancy loss, so then we will want to potentially work with someone where again they have clinical experience and that they're training, that might be their specialization in working with pregnancy loss. Also, as we are bringing children into our families, or we're expanding our families, that couples counseling can be important. That children bring joy and life and happiness, but they also bring stress, fatigue, annoyance. It changes the dynamics. That when the child comes in, that our lives and our relationship is not going to look the same. It's going to look different, and it doesn't have to be bad or worse, but it's not going to be the same as it was before. So having couples counseling to prepare the entire family for what that transition will look like, that we just can't focus on if this is the first child. We're not able just to focus on the two of us. This baby's going to demand a lot of attention. So what does that look like when either partner is not getting that same sort of support and attention that they used to get? When these stressors happen, how are we going to deal with the stress so that our marriage still remains strong, our relationship still remains strong? Doing that couples work to identify potential issues before they become a problem in the marriage, and just also, again, normalize that it's going to be a transition period and how to support each other through this transition.
That's excellent. That is excellent advice.
Mm-hmm.
Thank you. Well, I would like to know, what is something it could be general, it could be specific. You've given us a lot, but what is something that the general public doesn't know about your specialty area that they should know?
Mm-hmm. So I think, speaking more broadly, that psychotherapy, counseling, it's a science. So this idea of, I'm not going to pay to talk to someone, I just have friends that I can talk to. Well, your therapist is different from your friend, because think about my own training. I have a 4-year bachelor's degree. I have a 3-year master's degree. I did a 4-year doctorate. I did a 1-year intensive internship. I did a 1-year postdoctoral fellowship. I then had to get licensed in my state and pass the state licensing exam and oral examination. So post-baccalaureate, I have an additional 8 years of training. I am not your friend. I'm a licensed mental health professional, and I have put lots of time, energy, and finances in developing these skills. So we're not paying someone to be our friend. You're paying for a licensed professional to work with you. And different from our conversations with friends, there was this really great study that showed what our brain under an MRI looks like when we're talking to a friend versus what our brain looks like under an MRI when we're talking to a therapist. It's lighting up very differently when we're talking to a therapist than we are with friends. So there's something different happening in the brain when we're working with these trained professionals. So our work, even though we don't know exactly all the dynamics that are going on, it's not a mystery either. That there are skills, there are resources, there are insights that you can gain from therapy that can help with managing our mood, having better stress and anxiety control, being able to change and alter our thoughts to thoughts that are more conducive for what's realistic for our lives. That in therapy, we're doing things that improve our relationship with ourselves and our relationships with others. So the therapy is not a mystery. It is a science, and we know that it works. We know people who go to counseling, in comparison to those who do not, they do better. So just wanted to express that, like, therapy works, and that therapy by itself is effective. Just have your therapist do what you need to do. Therapy also works well in conjunction with other health professions. So you can have your therapist and you can have your birth coach. You can have your therapist and you can have your doctor. You can have your therapist and you can have your doula. All these components fit together. You can have therapists and you can have God. All these things can combine together to best support you in getting.
I know that's right. I know that's right. You say therapy and God. Yes, yes. I want them both, because as a nurse, and I take God with me when I go to work. One time I had a patient say, "I forgot, oh Lordy." I said, "Lordy, he's not on my shift. He can't have on my shift. That we can pray together, but he can't have you. Not today, he can't." So yes, putting them together. But with that, it's frustrating how many therapists I have gone through. Like I've had a really, and not just me, a lot of my friends, my own family have had a hard time finding therapists that are culturally competent. Mm-hmm. Culturally competent, that big term. I feel like it's a big term that just means they can understand where you're coming from, right? Mm-hmm. And I've had a really tough go of that. Like, what is your suggestion to find somebody? I mean, I keep going to find somebody. If I could tell you some of these stories, I'll take this part out. I was telling Zephyr, I had a therapist, this was not too long ago. She was washing, I could hear her washing the dishes. The screen was off, the stuff was off. Like the screen, had her screen blacked out, and she was washing dishes in the background. Mm-hmm. So
yeah, you're not focused on me if you're washing dishes.
So for people who who've struggled to, or not struggled to find, how do you find somebody that you feel is culturally competent to talk to you?
Mm-hmm. Yeah. So first, that it's a reasonable expectation you have to work with a therapist who is going to, they won't know everything about who you are as a nuanced individual, but they have a broad understanding of your culture. And then they are going to specifically want to know how issues that you are facing are going to be impacted by your culture. Working with a therapist who sees you and recognizes how culture then impacts you overall as a person is going to be important. That culturally competent therapist first needs to focus on themselves, recognizing their own biases, things that they've internalized, and doing their work to rid themselves of those biases and stay open to challenging themselves around that. This is going to be the therapist needs to be able to do those things. And then when we're looking for that therapist, like I was talking about with the physician, the same thing with the therapist. A culturally competent therapist is going to understand why you're asking questions about culture and be able to answer that without being offensive or guarded or saying things like, "I treat all people the same." but not everyone's going to have the same experience. So I need to know that you're going to understand what my unique needs are. So we can ask them, again, what are your experiences working with Black women? What sort of training or competencies do you have in working with Black women? That same question, if there's miscommunication, how is that going to be handled and addressed in here? So there's 4 things that happen in therapy for it to be effective. The most important thing in therapy working, surprisingly, interestingly, has nothing to do with therapy and has to do with the individual client. So the things that they are doing outside of therapy to take care of themselves is going to help therapy to be more successful. And then that second largest variable in therapy working is the relationship between the therapist and their client. So the more that we as clients feel heard, understood, respectfully challenged, therapy is going to be more effective. And the more our therapists can understand us, help us see blind spots, therapy is going to be more effective. That relationship is so important. Therefore, when we are finding that fit, we have to feel comfortable with that therapist. We need to feel like our therapist understands us, is respectful of us, practices good humility when it comes to the things that they don't know about us and working to understand us. Therefore, it would be okay to ask questions or to bring up when it feels like there's a rupture or there's something going on in the relationship. So being able to ask, what are your experiences working with people who have my identities? If there is miscommunication, then how will you address that? How have you addressed your own biases and things that you've internalized? If a client asks me those things, I would be super excited. Like, oh, this is fabulous. Good for you. You are trying to find someone who's going to be the best fit for you. Appreciate that. So to be excited by those questions of that client already coming in, advocating for their needs and their concerns. But yeah, it can be challenging if you are a woman of color looking for a therapist. And there's some resources that are designed specifically for BIPOC, Black women, women of color, communities of color and finding therapists. So one resource that is very popular is Therapy for Black Girls, where the therapists on there have identified themselves as specializing in working with Black women or issues impacting Black women. There's also broader resources for people of color, like InnoSyc, it's INNOSYCK.com, CH.com, InnoSyc, and that is for people of color to find competent therapists there. And just another resource is BEAM, which is Black, Emotional, and Affirming Mental Health Care, is another resource for finding those culturally competent providers. And after this, happy to send you a list of those therapy resources.
Thank you. I will, and I certainly will add those in so everybody can see, because I actually follow the Black girl therapist
Therapy for Black Girls.
Therapy for Black Girls. They always post really meaningful, helpful things. So I'm familiar with them. The other I hadn't heard of, but I can only imagine that would have saved me some steps. Finding a therapist.
They're even listed in the handbook, so there's a full directory within there.
Tell us more about your handbook.
Oh, sure. So, released in February is, get a good image of it, a handbook on counseling.
Can you get it a little bit closer so it's not like blocked by the light? Thank you. Yes, that's perfect. Thank you. I love it.
A handbook on counseling African American women, psychological symptoms, treatments, and case studies was released in February of 2022, and it's been doing really fabulous, and is such a needed resource for the therapy community. This handbook came from the recognition that African American women, Black American women, our mental health needs aren't always seen, known, and they can show up differently. And again, for therapists to be culturally competent in working with African American women. that still today, even though there is a greater focus on cultural competency and cultural humility and multicultural orientation, still predominantly therapists are being trained in Western, white, heterosexual, able-bodied, cisgendered, middle class men are still oftentimes the norm for research. So we're being trained in those dynamics. And then as a supplement to that training, then we may be getting training and working with specific populations outside of that. So when Black people and Black women are entering treatment, things that might be culturally sanctioned or culturally normed aren't always looked at that way. And then we see Black women being pathologized, things that are culturally normed are being pathologized. We see Black women being misdiagnosed, underdiagnosed, overdiagnosed. And then there's great cultural stigma around getting mental health treatment. And this cultural stigma is not coming from just nowhere, that there have been hurts, wrong, and abuses in healthcare in the mental health field, that rightly so, the Black community would be apprehensive about receiving care. So we need therapists to be culturally competent in understanding that your African American client might not be resisting treatment, but you really need to work on that relationship because they have reasons to not necessarily just sit down and right away trust that care. That would be a component of that cultural competence. So this book is wanting to better the services provided to Black women, that we can have unique needs and mental health care needs that when we're working with therapists who are not culturally competent are going to impact our overall mental health, and wanting to limit those disparities or rid those disparities so that Black women can enter treatment, feel heard, feel seen, be understood, that their lived experiences are being validated so that they get the help and support that they need, is really what this book is about. Mm-hmm.
To fill in the gaps that are missing from the training.
Mm-hmm. And these are large, very large.
It's a huge gap, because if you're only looking at that very small community, and it's the same in healthcare, right? With medications and things like that, they do research. It's mainly on white men, and so those gaps need to be addressed. And I thank you for putting forward that huge resource, because it's impactful.
It's needed. It's very much needed. And this book focuses on Black women, but this is not a Black women's book. This is a book for all mental health professionals, that most of us are being trained, again, in those paradigms that aren't developed for Black women. So if we are a Black woman therapist, this book is going to be very helpful and impactful, because we might have to decolonize our mindset or liberate our mindset and what it means to work with Black women. And it's also important that non-Black mental health providers and male identified providers use this resource too, that within the American Psychological Association, about 2 to 4% of active psychologists are Black. In social work, I think there's about 4% of social workers are Black, and I think 2 to 3% of psychiatrists are Black. So number one, that just because we're Black does not mean that we only need to see Black people. But two, if you were wanting to see someone who is Black, just the numbers aren't there. So more than likely, people who are Black are having to work with people who culturally are different from them. So there's not a book only for Black women, that Black women are going to be seen and treated by men and people who are not Black. So that they need to have those resources and that cultural competence in working with us, because oftentimes their care is not going to come from someone who is culturally similar to them, but it's someone who's going to be very culturally different than them.
Well, thank you so much. I really appreciate it. Again, I cannot express my appreciation enough for you coming on, sharing all of the preparation that can go into getting yourself mentally prepared to incorporate a new little person. So thank you again.
Thank you for inviting me. It's been nice talking about motherhood and that journey to motherhood and all the things that we can do to try to have the healthiest experience possible in our motherhood journey.
Yeah. Thank you. All right.